A statement by Chairperson of Parliamentary HIV and AIDS Committee, Rabson Shaba, reveals that HIV-AIDS prevalence is much higher among people who are in stable relationships. Shaba made the statement as the world commemorated World AIDS Day on 1st December. Shaba said since the day was first commemorated in 1988, Malawi has made tremendous strides in the fight against the pandemic. For instance, he did mention of distribution of free ARVs, among other milestones.
I feel greatly honored and humbled to be given this opportunity to make a few remarks today, the 1st December of 2011, which is the World AIDS Day, as Malawi in general and the Malawi National Assembly in particular joined the international community in commemorating this day. You will recall, Mr. Speaker, sir, that Malawi alongside the international community has been commemorating this day since 1st December 1988. The House will also recall that in remarks which the Deputy Chairperson of the HIV-AIDS Committee made last year in this House on behalf of your committee, sir, she observed that the Malawi government continues to acknowledge that the World AIDS Day has provided a key opportunity to raise further awareness in communities and across the world about the state of the pandemic and critical steps that must be taken to halt its spread. As we might be aware, Mr. Speaker, sir, the theme for this year's commemoration, which was announced on 9 September 2011 in Cape Town, South Africa, is getting to zero. That is zero new HIV infections, zero discrimination, and zero AIDS-related deaths. We may wish to note that this is an overarching theme within the broader thematic framework adopted by the United Nations and will run for the next 4 years until 2015. Therefore, players in the field here in Malawi may capitalize on the time frame as an opportunity to factor interventions into their subsequent budgets. This includes, Mr. Speaker, sir, public institutions. Mr. Speaker, sir, according to the 2010 Malawi Demographic and Health Survey report, it is estimated that 99% of Malawian men and women have heard about HIV/AIDS. Furthermore, it is also observed from the same survey report that 10.6% of Malawians aged between 15 and 49 years are HIV positive. In 2004, for example, 11.8% of this age bracket was HIV positive. In this regard, Mr. Speaker, sir, it is not an overstatement to observe that although there is a drop in the percentage of infected people, there has been a little change in Malawi's HIV prevalence since 2004. Mr. Speaker, sir, it is also worrisome that it would appear that in Malawi, the pandemic continues to take gender dimension in many aspects. In this respect, it is noted that women continue to become infected at younger ages than men. Prevalence for both men and women increases with age until it peaks at age bracket of 35 to 39 for women, accounting for 23.8% of the bracket. While for men, the age bracket of 40 to 44, which is 20.9%, are infected with the virus. Mr. Speaker, sir, further to the aforesaid findings, according to the operational plan of the National HIV Prevention Strategy of the National AIDS Commission Phase 1, which ran from October 2009 to June 2011, there are several parameters that can further inform our depth and critical understanding of the state of the epidemic in Malawi. Sadly, we note that 47% of new infections are found within stable relationships. Even among the youth being in long-term relationship is correlated with increased HIV prevalence. The House may further wish to note, Mr. Speaker, sir, that Malawi's HIV epidemic is driven by adult sexual behavior, falling within the 20 to 39 age bracket. Only 8% of the new infections come from the most at-risk populations, such as sex workers, men who have sex with fellow men, truck drivers, and others. In this regard, over 90% of new infections among adults in Malawi come from concurrent and multiple sexual partnerships and also what are known as discordant couples. Mr. Speaker, sir, we note with some measure of satisfaction that AIDS-related deaths are now at 5%, down from 11% in 2004. The latest UN AIDS report indicates that worldwide the deaths have gone down by 21%. As a committee, we applaud government of Ngwazi Professor Bingwa Mtalika for putting more people on antiretroviral therapy, as more and more people access treatment coupled with good nutrition, we believe that less people will die from the pandemic. We believe that emphasis should also be placed on youth, with quality prevention programs, and the faith community may also play a pivotal role by encouraging our young people to get tested for HIV before getting married.
That is Rabson Shaba, a parliamentarian but also chairperson of the HIV and AIDS Parliamentary Committee.